Joining us now is Dr. Vinay Prasad. Dr. Prasad is a hematologist, oncologist, and a professor in the Department of Epidemiology and Biostatistics at the University of California, San Francisco. Very impressive, and I feel like an idiot. He's also a contributor to the Free Press and wrote a piece this week called A Simple Litmus Test for RFK Jr.'s Ideas. Dr. Prasad, welcome to the Free Press Live. How you doing?
It's great to be here. Thanks for having me.
Let me ask you just a question. You know, I read this piece and you go through a lot of his ideas. Let's just get a top level thing from your position as somebody who knows this stuff very well. What do you make of the nomination sort of writ large? Do you think it's a good choice by the Trump administration?
Well, that's a good question, but I guess I'd put it this way. I think the choice reflects what Trump sees as his mandate, which is to shake the snow globe up. I mean, I think Americans, by voting for Trump, said that they're dissatisfied with the status quo, and Bobby Kennedy is different than other HHS nominees in the past. He's got a lot of ideas. I mean, there are 20, 30 things we could talk about. Some of those ideas are good ideas. Some of those ideas are debatable ideas. Some are outright outlandish and perhaps even off the beaten path and don't make any sense to me. But he has a lot of ideas. And if he were to incorporate even some of these ideas, it would signify perhaps the most important HHS changes in the last 25 years.
Your piece is so good. We were talking about it earlier. Like just the execution of this piece is so beautifully done. You have a list of his crazy ideas, and then you have a standard, a test, where you say, here's the test we should use to decide which ideas to put in the let's try this bucket and which ideas to put in the let's throw this in the garbage bucket. And the standard you suggest is, do our peer countries in the West, in Europe, do some of these ideas? Do they accept these ideas? I encourage everybody to read this really wonderful piece, but why don't you take us through a few of the ideas, which ones you think are worth trying out and which ones you think are really terrible?
Well, thank you for saying it's a well-written piece. The credit should go to the editorial staff at the Free Press. They turned my writing into a well-written piece. But the answer to your question is, I think the media covers RFK Jr. so unfairly. They want to fact check him, and they'll point to one thing he said here, one thing he said there. And sometimes they even incorrectly fact check him. They say he's wrong about this, but he actually has a really substantive point. And the litmus test, I say, to separate his ideas from the ones we should be debating to the ones that are really just too outlandish to consider, is just to ask a simple question: do other countries do it? Do other countries do it? Because if he's suggesting something that other countries are already doing, that suggests that at least there's some dialogue to be had there. It might be that he's ultimately wrong, the other country's mistaken, but at least it's not something that all sensible people dismiss out of hand. So I'll give you a few examples of some of the things that he suggests that other countries are doing. One is he wants to remove an FDA prohibition on selling raw milk, which is unpasteurized milk. Now, this is something that I think concerns some people because there is a risk, of course, of getting very sick if you drink raw milk. Emily Oster, the economist for the New York Times, she quantifies the risk as 7 out of 100,000 people drinking raw milk. That's the risk of getting infected. And her point is that risk, whether that risk is higher than pasteurized milk, but it's a risk that we allow people to accept. It's like the risk of eating soft cheese or going bungee jumping or things like that. It's a risk that we typically allow Americans to accept. And RFK Jr. is not saying you have to drink raw milk. And let me be clear, I won't be drinking raw milk, but he's saying that people should be allowed to drink raw milk if they want. And I think in that respect, he's in line with many European nations detailed in the article, including France and Germany, where he's in good company, that there are other nations that allow people to sell raw milk. Another one of his ideas is fluoride in the water. Now, fluoride in the water has a really important history. In the 1920s in America, we started to fluorinate water, and the benefit was very clear early on that children had much less cavities in youth, probably because their pregnant mothers were exposed to fluoride in utero, which was allowed to incorporate into teeth, which make them much stronger and resilient to cavities. But since the 1920s, across the world, there have been some countries that fluorinate their water and some countries that don't. And cavities have declined in all the countries across the board, in part because we use fluoride-containing toothpaste, in part because we have better oral hygiene. All sorts of changes have occurred. And now the benefit of fluoride in the most recent Cochrane review on cavities in children is much smaller than it was in the original studies that came out of the 50s, 60s, and 70s. Meanwhile, putting fluoride in the water has not been clearly linked to, but there is some speculation and there are some sort of weak epidemiologic studies linking fluoride into the water to perhaps small differences in cognitive performance, et cetera. RFK Jr. has a point that if you take a very high level of fluoride, which we're not typically exposed to in our water, that's clearly a neurotoxin, and I think that is true. But I think other countries, like Germany, for instance, don't put fluoride in the water because they have a different calculus. Should we put fluoride in the water so many, many people drink it, even people who won't derive much benefit, so that it gets children to also consume fluoride? And I think that's something that we could debate. I mean, some people might say there are other ways to accomplish the goal of reducing cavities in kids. Then I guess maybe I'll give one example of where I think he's clearly off the mark. And I think that's when he talks about the risk of the MMR vaccine causing childhood autism or autism spectrum disorders. I think this is a question that's been, raised for 25 years now, since a famous paper by Wakefield in the Lancet in 98. And it's something that's been repeatedly studied in many, many large data sets. And the answer is resoundingly, there is absolutely no link between the MMR vaccine and autism. And so that's, I think, a false claim that wrongly stigmatizes a very important vaccine. And I also want to draw a distinction between the MMR vaccine and maybe the COVID-19 vaccine in kids. The MMR vaccine is something that if a high enough fraction of the population takes it, you will not have measles. And measles is, in fact, a terrible disease. We forget how bad it is. Some kids die of measles outbreaks. And so if you achieve a certain target level, you won't get measles. The COVID-19 vaccine, of course, is a vaccine that no matter how many people get it and how many boosters you get, the virus is just going to keep circulating and it's not going to be able to halt transmission. And children have the least to gain from vaccination from COVID-19. Most European nations don't vaccinate children for COVID-19. But our US CDC has incorporated COVID-19 into the routine immunization schedule, which was another piece I wrote for the Free Press. So to put it all together, I think Bobby Kennedy has some ideas that are in line with our European peers, and in many ways sort of liberal ideas. They're progressive ideas. Some ideas that are deregulatory, some ideas that call for more regulation. He's not, making raw milk available as a deregulatory idea. And he has some ideas that are, I think, clearly outlandish, and he tells outlandish stories like the bear in Central Park, et cetera. But I think we should be able to judge his ideas individually.
Dr. Prasad, I think that we probably have, a ton of common ground when it comes to COVID stuff, lockdowns and, kids getting vaccines. I was skeptical of all this stuff. I mean, I lived in Sweden for a long time, and I think Anders Tegnell had the right perspective, and that was borne out by the data later. And so in that stuff, I agree. I mean, the MMR stuff, he's still on this stuff many years later. And as you point out, and we had a piece that ran in the Free Press about a week before yours, pointing out that no epidemiological studies at this point that are credible ones have made that link between the MMR vaccine and autism. The question I have for you is this. I have been writing for many years about people who are conspiracy theorists. Robert F. Kennedy Jr. is a conspiracy theorist, in my estimation. It's not just this stuff. He might be right on a lot of things, and that's true of conspiracy theorists often. But, his book about Fauci, I read this book, and I know a lot about these people that I think are kind of wrongly called AIDS denialists. But, the Peter Duesbergs of the world and Kerry Mullis and these people. And he's in that camp of people who don't believe HIV causes AIDS. He's tweeted about chemtrails. He believes his father wasn't killed by Sirhan Sirhan and his uncle wasn't killed by Oswald. That one he actually has, a lot of Americans agree with him on the second one there. But he has a conspiratorial mindset. Is there not somebody in your estimation that could do this job of sort of blowing up HHS or at least reforming it, who doesn't have the whole palette of crazy views, but has the ones that you like and the ones that I like too, but just doesn't go into that conspiracy world?
There are probably 10,000 people who fit that bill, who have the views that you and I like, but don't have these conspiratorial views. There are many such people, I think. But the problem, I think, is that if it's not RFK Jr., it's not going to be any of those 10,000 people. If it's not RFK Jr., it's probably going to be a more typical Republican nominee, someone like Alex Azar, somebody like a Scott Gottlieb, somebody who spent their career rotating between pharmaceutical firms and government positions, someone who's never staked out strong claims on any issue, I think, somebody who's kind of flying underneath the radar. There's no paper trail to look at. They're a conventional thinker, probably. They have no conspiratorial views, but they probably won't do anything about childhood nutrition. They won't do anything about agriculture. They won't do anything about trying to improve safety detection of drug products. I think you will get a very typical Republican nominee if you don't get this guy. And then the last thing I'd say is some people ask me, well, aren't you worried about a lot of the things he says? And I'm like, of course I am. As a doctor, I think some of the things he says are irresponsible. But I think there's one important check and balance that is here, which is that if RFK Jr. tries to do anything substantive to, I think, thwart polio vaccination or MMR vaccination, he's going to get pushback from the media. He's going to get pushback from doctors like me. He's going to get pushback even from other Republicans. And I think that's different than what we saw in the last 4 years, where you had a series of COVID policy advisors who were really marching lockstep with the media. Anytime Biden announced a new booster, I said it was a 3 vaccination series after all. I meant 4, I meant 5. The media did not question that narrative. They unthinkingly put that forward. Vaccinating children, I think, was incredibly controversial, and yet the media put no resistance on that policy. So to me, in some ways, what's more dangerous is somebody who comes into this position, claims I am the science, and nobody questions or is allowed to question what they say, rather than someone who's got a history of saying outlandish things in which we're all going to be on him if he does anything, I think, out of line.
But Dr. Prasad, one follow-up on that. Is there anything that does worry you, that you see a path towards, him achieving some goal that you think would be a net negative for health in America?
I mean, I think the path would be, I think if he puts too much rhetoric into the dangers of some routine childhood immunization, I think there's a path that there will be outbreaks of measles. At the same time, if somebody were to try to moderate him, which I would try to do, if I would advise him, moderate him, I would point out that the U.S. immunization schedule for children and the one in Switzerland and the one in the U.K. and the one in Sweden, they're different. And we have vaccines that we routinely give that they don't give. And I would always take RFK from, instead of having a conclusion, let's do the study. And I think you can compare a U.S. program against a Swedish program. I think you can improve safety detection. You can say, look, we're not persuaded that MMR vaccines cause autism, but why don't we build a system where we actually are able to detect these safety signals? You might remember that for COVID-19 vaccines, there are 2 really important safety signals: myocarditis, or inflammation of the heart, from Moderna and Pfizer, and a sort of disseminated blood clotting disorder that happened from Johnson & Johnson. Both of those signals were discovered in Europe or in Israel. Neither of those signals were first discovered in the U.S. We think in the U.S. we're the best at drug and vaccine safety. We are not. We have a broken and antiquated system. So I would try to channel his energy towards building a better safety detection system, and rather than actually making strong statements about childhood vaccines that I think are unfounded.
You just made me so mad. So like Michael, I'm sort of a bit of an RFK Jr. skeptic. I worry that, healthcare is such an important issue to Americans, but I feel that his focus is on the wrong thing. When I was writing my book and traveling around the country and interviewing working class people, they couldn't afford health care. They couldn't afford high quality, regular visits to a doctor. The privatization of pharma, yes, but also the insurance cartels, hospital administrative costs, which have resulted in the astronomical ballooning to $12,000 per year per capita for our terrible healthcare system, right? I mean, these are all very commonsensical problems that I think do need somebody to take a real axe to, but I think that the thing that gets RFK Jr.'s heart pumping is the link between autism and vaccines. I mean, I think he's focused just on the wrong problem because of this conspiratorial mindset, and I worry that Trump understood viscerally, the way he understands many things, that healthcare is important, and was one of the remaining reasons that working class people still hung on to the Democratic Party. But instead of having a real thought process as to how do we tackle the real problems, that poor people are obese because they don't have good jobs, they don't have good health care, and men are depressed and they're not getting exercise. Like, instead of looking at just the social problems and the economic problems that drive the majority of our problems in healthcare, he picked RFK Jr., who I think was really smart because he was a Democrat and showed the unity aspect of Trump's campaign. But again, that conspiratorial mindset, I mean, you look at what he has spent his life doing, and I just worry that it was a bit of a swing and a miss. What do you say to that, sir?
Well, I think you are hitting the nail on the head in terms of what the core issue is. In America, we spend, nearly 20% of GDP on healthcare, and we have outcomes that are beneath all our peer nations. And that the working class person feels. That means your actual take-home wage has not risen in decades. You feel poorer and more impoverished. You save to spend on healthcare, and much of the healthcare we're spending on is wasteful, bloated, unnecessary. You're absolutely right. The administrative state we've created, the way in which insurance companies profit from running up healthcare costs, not the opposite, actually. In many ways, pharmaceutical firms extracting huge payments. You're absolutely right. That is the most important issue. And if you were to make a dent in that, you'll change how people feel in their day-to-day lives.
Yeah.
Now, to that point, I think to some degree, it will go to CMS and will go to Oz potentially, who is the CMS director based on the nomination. Oz has previously expressed a sort of a like of Medicare Advantage plans. This is a privatization of Medicare that a number of recent studies have shown actually increase costs, increase administrative bureaucracy, and don't actually deliver better care, the Medicare Advantage plans. So Oz would have a potential to, if he wants to do something there, he could really reform Medicare Advantage and hold them to a high standard, or say, we're going to put the squeeze on you and cut you out. Now, RFK Jr. is interesting because in the past, I think he's expressed at least admiration for sort of a Medicare for all kind of plan. He may even be closer to Bernie in that regard, and not a typical Republican. But how you solve CMS, the trillion-dollar elephant in the room, I think is the core issue. And if I were to give suggestions, I would say the number one problem is in America, we approve too many drugs and devices with really uncertain evidence they help people, and we pay for those products. You need more of what they call coverage with evidence development in CMS to pay for it, but only in a way in which you learn more about it. Should we keep paying for it or not? And I think that would start to reduce the healthcare spending. The last thing I'd say is, many people thought Affordable Care Act would solve this problem. And in some ways, it was a really important bill because it gave insurance to people who didn't have it. And it did appear to curb the growth of healthcare spending. But curbing the growth of something is like having a lower inflation rate in next quarter. It's gone down, but people are still hurting, and it's not really the solution. Healthcare spending is still going to keep going up to 25%, 30% of GDP unless people take action. And I think no society can exist when 50% of GDP is spent on healthcare, for instance. There's some ceiling to what we can do.
Dr. Vinay Prasad, thank you so much for joining us. I don't know why you didn't sign up for this job.
I know, right?
I mean,
Dr. Prasad for HR.
I don't know. I mean, maybe you believe in chemtrails and we just haven't talked about it. But thank you so much
Thank you,
for being here. We look forward to the next piece you write for the Free Press. Is that what we're called?